Hello, my name is Natalia and I am going to discuss and explain what fetal monitoring is, why and how we do it. During your pregnancy, labour and birth, various assessments are carried out to ensure everything is progressing normally and your baby is not experiencing any difficulties. One such assessment is listening to the baby's heartbeat. Most babies go through pregnancy, labour and birth and are born without any problems. However, there are some babies who have difficulties, and the best way of finding out when a baby is experiencing difficulties is to listen to their heartbeat. You will be offered to have your baby's heartbeat monitored, known as fetal monitoring, during your pregnancy, labour and birth. Fetal monitoring can be done in two ways. Intermittent auscultation, listening for a short time at regular intervals with a Doppler or Pinard stethoscope. Continuous electronic fetal monitoring, EFM, known as continuous monitoring, using a cardiotocograph, CTG machine that draws a graph of your baby's heart rate and your surges or contractions. Intermittent auscultation is monitoring your baby's heartbeat by using a Pinard stethoscope or handheld Doppler. During your birth, the midwife will palpate your abdomen to feel for a contraction. They will listen to your baby's heartbeat for a full minute at the end of a surge or contraction. I'm going to just listen to your baby's heartbeat for a minute with Pinard. Is that okay? As labour progresses, your baby's heartbeat will be checked more often. In the first stage of labour, your baby's heartbeat will be monitored every 15 minutes and every 5 minutes in the second stage of labour. Your pulse will also be monitored at the same time to differentiate between your heart rate and your baby's heart rate. A cardiotocograph, CTG, carries out continuous fetal monitoring or electronic fetal monitoring. It produces a visual display and in some cases a paper recording of both the baby's heartbeat, the mother's heartbeat and any uterine activity. Two discs called transducers are placed on the abdomen with some gel. These are held in place with two elastic belts. Belts around here. One disc picks up the baby's heartbeat and the other disc picks up the frequency of the mother's uterine activity. Sounds like a happy baby. So this is the monitor to measure any uterine activity. So we put it here at the top of the uterus, okay? The machine produces a continuous graph of both of these referred to as the trace. The machine also produces a beating or pulsing sound that represents your baby's heartbeat. Your blood pressure, heart rate, temperature and oxygen levels will be all checked regularly throughout your pregnancy and birth. So I'll get you to put your finger in there. Yeah, and both numbers come up here, Vanessa. You may also be given a clicker to push every time you feel your baby move. Vanessa, Lisa. This is a little monitor to measure your baby's movements. So every time you feel your baby move, can you click the top button there? Mobile CTG monitors are available to enable you to mobilise and change position while being monitored. If you're admitted to hospital with any issues after 26 weeks of pregnancy, a daily CTG will be recommended. If your pregnancy or birth is considered high risk for any reason, a CTG will be the recommended method of fetal monitoring during your baby's birth. A list of common reasons where continuous fetal monitoring is recommended can be found in your fetal monitoring leaflet. Your healthcare practitioner will discuss the recommended method of fetal monitoring with you. They will answer any questions you have, and your consent will be sought prior to carrying out any fetal monitoring.